friends, this is Dr. Aleemuddin from Hayat Hospitals. Let me start by wishing you a very happy and healthy Ramadan. This Ramadan has come with two specific challenges for all of us, especially for the diabetics. First is the challenge of long fasting hours due to summer from 14 to 20 hours in some countries. Then with this pandemic, there has been lockdown globally with little or no physical activity. Now let's talk about diabetics who are planning to fast in this Ramadan. International Diabetic Federation has stratified diabetics into various risk categories for people who should fast and should not fast. The first very high risk category of patients are those who are with having any chronic kidney disease or chronic liver failure, or people who had an episode of low sugar, that is hypoglycemia, or high sugar hyperglycemia, or any history of diabetic ketoacidosis. These patients should not fast. Then comes the second category of people who are on insulin in type 1 diabetes, or people who are taking oral medications but with uncontrolled sugars. These patients need to consult their doctor before fasting. Now let's learn about 3 common mistakes which we do in Sahar and 3 common mistakes which need to be avoided in Iftar. The first mistake which we commit in Sahar is eating immediately after waking up. After long sleep, we overeat, assuming that there would be long hours of fasting. This takes a toll on our digestive system and this food is not processed. Second mistake which we do is eating leftover food or eating fried food, which needs to be avoided. Third mistake which I consider as a sin is avoiding Sahar. Some of us are very lazy and tend to avoid Sahar, which is highly unrecommended. Now 3 mistakes which we do in Iftar. The first and foremost is fasting after feasting. This means that immediately in our Iftar, after breaking fast, we tend to feast. That is, we eat a lot of fried items, vegetables, salads, desserts, sweets, and many things at once. Now what happens is, after a gap of 12 hours, when you try to push so many things in your digestive system, they are not processed, and this leads to increased sugar levels which are dangerous for all of us, including diabetics. Second mistake which we need to be avoided in Iftar is eating processed or fried items. We tend to eat a lot of dahi vadas, samosas, keema, vada pavs in Iftar after breaking the fast. Now what happens is, these are all high glycemic foods which release a lot of sugars immediately, which our body cannot take. This needs to be avoided. And the last mistake which we do is we tend to do little or no physical activity, especially in this COVID lockdown. Avoiding this physical activity leads to lots and lots of muscle damage and lowering of immunity. Little physical activity is highly recommended. Even our Tarawih prayer helps us to do this physical activity. So the 3 mistakes to avoid in Iftar is avoiding feasting after fasting, avoiding overeating of junk or fried foods, and third, not having any physical activity. Having Tarawih prayer is highly recommended. So these things need to be avoided to have a happy and healthy Ramadan. This is Dr. Aleemuddin from Hayat Hospitals. Thank you.